A very good evening and a very warm welcome. I have the privilege of welcoming you all on behalf of the Counsellor Empowerment Program. This is our second program, and I'm very happy. It's a special program because Dr. Pankaj Talwar, in spite of being so busy, he will be here with you to do Man Ki Baat, and heart to heart he will be doing with all of us for about half an hour or 20 minutes. And this is the presidential program, and this is a very, very well thought of program. And today I will just brief you about, in short, about the program which is going to be done. We will have the vision for Counsellor Empowerment Program by Dr. Pankaj Talwar, who is the president, and Dr. Shweta Mittal, our general secretary, followed by introduction and highlights by Dr. Leena Vadva, an insightful dialogue between two very experienced counselors, our prized counselors, Dr. Amita Puri and Dr. Veena Acharya. Then we'll have a very special case-based scenario, role play on donor site. Dr. Veena Acharya will do that part. And an update on IFS support app. As we discussed in the previous meeting, there is a IFS support app which is being built up by Astha Puri, who is an AI expert. We will go on that, how much work has been done and what is next going to be done. Finally, Dr. Poonam Nair will be giving the concluding remarks, and you will all leave in a blissful, peaceful moment. This will be a maternal bonding trance session, small session by Dr. Amita Puri. So I'm Dr. Piki Saxena. I'm a director professor in the Department of Obs and Gynae at Lady Hardinge Medical College. Shivam, my slides are not moving.
Just click on the slide once.
Okay. Yeah. And I have been given the important charge of being the national coordinator of this very important Counselor Empowerment Program. And also I'm the SIG convener of early pregnancy. So I think Dr. Pankaj Talwar needs no introduction. Sir is I will just say a very few words, very important words about him. Sir is the president of the Indian Fertility Society, and he is the director of iSeat, iHoma, and iConsult. And I think Sir will break all records. He has a big fan following and a huge group of students. I think more than what medical teachers like us are teaching in a medical college. Sir is a passionate teacher. I've experienced it myself. He forgets time. He's not thinking about money. He just continues, and he flows with emotions, and he likes to give everything he knows to the teacher, to the students. He is dedicated and very disciplined. And he leads the team by example. I call you, sir, as a magic man because I think you have a Pandora's box. You are a man who is coming with so many updates, so many innovations since last 2-3 months when you have taken over as IFS president. And you are thinking of those groups whom NATO national medical bodies have thought not we have given any importance. The nurses, the counselors, the younger children, the new generation. And you are all teaching us all about AI, about yoga, self-preservation, all those new fantastic ideas. I don't know how you get them and from where you get it. And this program is especially very, very close to Sir's heart. And I think Sir believes in Modi ji's Sabka Saath, Sabka Vikas formula. And today, Sir has come here to connect with all of you. And I'll not stay in between to give Sir an opportunity to do Man Ki Baat. So, Sir, welcome once again.
Thank you.
Address everyone.
So let me share my screen, and here am I. I think the screen would be seen by all now, and thank you so much for being with all of us. I think we are at around, our number is around 45, 46. Thank you, Piki, for giving me this opportunity. It's always my dream from, I think, past 4 or 5 years that one day we'll have such a program running in our country. How it happened, I'll give you a brief background, how it all happened, why it came to our mind to have such a program at national level being done by IFS. So, but before I start, as customs demand, and from my heart, I'd like to thank you, Dr. Geeta, Dr. Piki, Dr. Poonam Nair, Shweta has already joined, and everyone we have with us today, Amita, we have Veena. Thank you so much for supporting our cause. And I think Dr. Leena is also here. So, what made us think about such a program? Why such a program? So, I'll take you through without taking much of your time. I'll take you to the brass tacks. In the army, we say brass tacks. Such an image is very common. Whosoever is, all of us are working in medical profession, but we are also working in IVF. And such an image is very common where we find young girls who are looking into the sky, who are staring into the sky. They don't know what to do. And this is their state. After, before they come for any sort of treatment, they're like this. After they become pregnant, they are like this. They can't believe it has happened to them. And for coming few months again, they are like this. They're so worried about the little baby which they are gonna deliver. They're so worried about it that they become an emotional wreck. Some are very happy, but large number of them they become emotional wreck. And I bring you my experience of 30 years in the Indian Army. Where 25 years I was involved with infertility practice. We have been I've seen people all across the stratas from various states. The army people, a lot of people come from mountains, they come from hills, they come from villages, deserts. So we come to see how these women behave, how the men behave in the various cross-cultural societies. Picture is also deceptive of a failure where the woman, something has happened to her. That's the amount of, the way, the agony, the tears in her eyes, and her mother or mother-in-law holding her tight to her heart, solace her, is is a very common picture. But unfortunately, we are living in a very fool's paradise, living in tier 1, tier B cities. We don't see the tears actually, how the people are behaving. Getting a negative report, since we're talking about fertility now, giving a negative report is, for her, she's waited for it for a few months. She has been pumping herself with a lot of things, emotions, and now this is what she gets. What I'm going to talk to you today is not from my imagination. I've seen people ending their lives. I've seen men trying to end their lives. I've seen women ending their lives. And what easier way to end their life like this? We are away from the reality. We are living in a very different strata of population, but 80% of the people are living in small villages. For them, getting motherhood is a very major issue because in case they can't become a mother, they are taken as a banj. The women, the day they conceive to day they deliver, and after they deliver, they are again emotional wreck mothers because they're so possessive about their children, as if they're guarding them all the time. So it's an emotional turmoil for the women in case we don't handle them properly. From the day they come, and not only the women, the men are equally in an emotive wreck. You have to handle both of them with a lot of care. Now, whom do these people go to? They go to somebody like him, me, and you, Picky. They come to someone like us. We have Dr. Geeta and Lina there as clinicians and a lot more. They come to us and they see us smiling and happy. And that's the reality, stark reality. So what is our role? I think my role, what I've learned in armed forces for 30 years, seeing around OPD of 400 per day, doing 150 pickups per month. We have to be like a sponge. We have to be like a sponge, taking away all the energies, sometimes positive, sometimes negative, being reflective, yet keeping quiet and taking them on in their journey. I think the counseling part, it doesn't, not only the patients they need counseling, I think by the end of the day, when I need counseling. Every day at the end of the day, I feel that I wish somebody could. I am acting like a sponge. I wish somebody could press me and take out whatever energies I have got today. But that's our duty. This is a regular OPD, a small little hospital, patients waiting. Doctors are running around everywhere. We start our day in the morning at 7, and by evening 7 o'clock, 8 o'clock, we are running around for what? Sometimes for money, sometimes for reputation, sometimes to do good work for the patient, for ourselves, our families. We are running around. The whole world is in a spin, and this is what becomes of us as the day ends. I can associate myself with him. Definitely. I don't know about all of you here, but I associate myself with him. And I think all of you who are here today, though I have not met majority of you, you're around 50 of us. I'm sure that you'll understand that what I'm trying to say is that we get tired. Whole our life goes around in monitoring. Sometimes you're on some device, sometimes we're taking some reports. So as a doctor, we are not only the patient, the whole amount of administration and creating happiness takes a toll. Our families take a toll on us. In the end comes finances. That's the time. Whenever we spoke about counseling, we always spoke about financial counseling. We always thought that we should have a financial counselor. कितने का पैकेज है, कितना पे करना है, कब पे करना है. So everything revolved around patient care, definitely yes, but around how to manage the money. In the army, we have had counselors since 2005. We have full-time counselors in the army from 2005. That's what I have seen at army hospitals. But after the government rules have come, now we are having counselors all over the country in every IVF center. It's a very healthy beginning. But now also a large amount of, when you talk about counselors, they talk about financial counseling. How to counsel a woman about a cycle. We're not going into the details of the counseling, and that means that we have to actually unwind the brains of that couple, take out, remove the cobwebs, and make them breathe again. This is a job of a counselor or job of anyone who can talk. Now, who is a counselor? Anyone who can talk is a counselor. The counselor can be a doctor, but doctor gets tired. It can be a nurse, gets very tired. End of the day, they don't have so much of time. Any session of counseling which I saw in armed forces, it took around 1.5 hours. Applying some tools, psychology tools, peeping inside their minds. It took around some time. And the whole team is themselves tired by the end of the day. Then are facing some errors. The errors can occur in terms of giving them the right medication. I've seen these errors occurring very frequently in a large number of centers. Where we forget to write a drug for a patient. We write a wrong drug. We give a wrong prescription. तो हमें ऐसा लगता है जो हम बात कर रहे हैं वही सही है और वही ठीक है. बट अनफॉर्चुनेटली इज अदर वे राउंड. जो वो सुनना चाहते हैं वो बात नहीं करते हैं. So we are so used to using our pen and writing like an English emperor that लिखा और साइन कर दिया स्टैम्प लगा के. So we feel that what we have done is the right thing for them. But trust me guys, that it is not correct. What is correct is sometimes we don't even know that what is correct for them. So we make errors. We don't talk to the patients. There can be errors in the laboratories. A large number of times we have heard that embryos have got mixed. The wrong patient has taken the wrong embryos or the right embryos. So this is again due to the counseling in the laboratory. We have not become so well equipped that we have got AI at every level, but we are trying to evolve. The problems can occur like this when we can't label the right stuff. We don't have proper barcoding. We don't have witnessing systems. So things can go wrong in the laboratory or in the pickup or patient labelings. Medically, financial counseling can go bad, and very frequently patients are wrongly billed and they're very unhappy. It creates a lot of bitterness. Every second, third day, I do get a patient who's not happy with my counseling, financial counseling. So sometimes what I tell them, they don't understand, and I feel that they have understood. Because fault is not mine, fault is not theirs. They are a bundle of nerves, and I'm a busy doctor. I think I'm a hopeless doctor. The doctor should find time for the patients. But we tend to get busy and we assume that we've got a danda in our hand and whatever we do, chamde ka se kaam chalayenge. This is a common state of a doctor. Now look at this doctor. You'll find that he's all surrounded by some technology. I feel that finally you become an idiot. From all the iWatches, iMacs, iPods, iPhones, you become an idiot. And we are depending more on the gadgetry around us and we are losing the human touch. I read about this gentleman around 11 years back or 12 years back when my counselor, we had a psychologist who was working with us. She's from Mumbai, working full time at Army Hospital. She told me about this gentleman, and I always remembered this guy. He is the father of psychology in the world. 1879, he felt that something should be done about psychology. So psychology, there are a lot of misnomers, overlap between various terms, psychologists, psychiatrists, counselors that we will learn. So 1879, he was a pioneer of psychology and called father of psychology. This is what the people have been thinking about it. And this gentleman, I think we owe a tribute to him. He's an Indian psychologist. He's father of Indian psychology. We have got with us Dr. Poonam, ma'am, Veena, and Dr. Amita. I think they'll know better about him. But I think we must pay tribute to Dr. Narendranath Sengupta. He was the first guy in 1900s who was a Harvard-educated psychologist. Think about it. Even today, till 3 years back, psychology was taken as a taboo. Not many people took counseling and psychology. But he's a gentleman. He's Harvard-educated Indian psychologist and he's a founder of modern psychology in India. And I think we owe a tribute to him for bringing this big science into our world. And I also like to thank the whole team here for giving us an opportunity to talk to you people. Difference between various terminologies. Who's a coach? A life coach. I can be a life coach. You can be a life coach. Who is a counselor? A psychologist or a psychiatrist. Depending upon what all we add in a glass of water, we complicate the science and more complicated it becomes, you become a psychiatrist. But at basic level, we are all counselors and coaches, life coaches. I firmly believe a counselor is an integral part of not only of an IVF center, but of the society. I always wanted to be a counselor actually in my life. But I joined gynecology and thanks to Picky, I'm here in front of you today. I always felt that this is the right branch for a person of my temperament. He should be able to listen, not hear, listen, open-minded, non-judgmental, rapport building, confidentiality. People pour their heart in front of a counselor, and if you go out and talking about them, I think that's what they won't do. They receive regular supervision and they will add on to build your strength, spiritual strength, physical strength, mental strength. Everything comes together, and that's a counselor. So, first quality of a counselor, I think a lot of you are counselors here, a lot of you are people like me. The first quality we should have is that we should listen. हमें सुनना है, कान में सुनना है, शोर नहीं सुनना है, जो बात बोली जा रही है उसको सुनना है, उसको माइंड में लेके जाना है. And how does it travel? Whatever we listen, it will go from our ears, it will go to our amygdala. Amygdala is a beautiful little part of brain. It will filter things which it doesn't want. Certain things will send it down to the lower brain, which is only to react and respond. Then amygdala will take on the bigger noises, filter them, and take it to our cerebrum, so they can respond to it. So I think whatever we talk to a patient or talk to with each other, that should go to our amygdala. Let amygdala filter it. But what we do is we are listening to so many noises around us that whatever they are talking, we don't listen. We only hear. And we have already got an answer. Before anyone talks to me, मुझे पता है क्या जवाब है इसका. This is the way we normally work. And this is where the counselor takes a main role. They are so trained and educated that they are good communicators. So I think all the counselors should be very good communicators. They should be able to make things clear to all of us. When I was in the army in 2005, we had every day we had around 150 people counseled. We had a big hall where we counseled nearly everyone in terms of psychology, not about medical treatment that I did. And then we had some classes on meditation, yoga. We had one spiritual guru coming. This is what we were doing. We're doing in the army from nearly 20 years now. They should be able to connect with everyone and then filter from here who needs help. The filtration is done by the eyes. They will spot you and tell you need help. You will take them separately and talk to them for half an hour, 1 hour, or 2 hours. A counselor should be a negotiator. Should be able to negotiate with them, meditate with them, mediate with them, and solve the disputes which are arising in our mind. Come to a common agreement with all fairness and build relationship. And so counselor is a true leader in any department. So I think time has come that we accept counselors as a very integral part of our society, part of our own IVF centers. I think we all need counseling. A counselor can play multiple roles. He can be harsh, or she can be harsh. They can be soft, but normally the counselors are always cool like cucumbers. I've always seen them very quiet. When I talk to Dr. Poonam, she's so quiet all the time, so gentle. I've never seen her getting angry. Now I understand what lies behind her. It's the brain of a counselor. Green is the color of peace. Cool cucumber. That's the way counselors are. Not like people like me who are always on tenterhooks. They should be able to connect with you like children communicate with each other. This we can't do. हम सब हमेशा हम मोल भाव करते हैं. हम मोल भाव करते हैं. हम we plan and we have all the answers in our mind already. That's not the way counselor works. A counselor should be able to put a little finger and say, sweetheart, let's walk together. That's what counselor does. It goes beyond the friendship bands. A little finger can make or save somebody's life. A counselor can give somebody in a very non-judgmental way a shoulder to cry. Hold somebody tight. And it's not only in despair or grief, it's also in happiness. Sometimes when people are so happy, they say कि सर आपको हक करना है. दुखी होते हैं तब भी हक करना है. And science for so many people, those ladies always keep coming to me कि सर आपका हक चाहिए. Keep your hand on my head, then I will go. So this is the way we should connect with the people, and he's my godfather. He's my godfather. He's Matthew Ricard. He's the he's the happiest man in the world. He's a PhD in genetics. Very big man, very big man. They run an experiment on him for nearly 8 to 9 years. 278 sensors on his brain, off and on. And he was framed. He's in Bhutan. He's a monk now. His name is Matthew Ricard. I always look to him. बहुत अच्छी बात बोली इन्होंने. A healthy mind should act like a mirror. मिरर के अंदर शक्ल दिखती है, पर मिरर किसी भी फोटोग्राफ को कैमरे जैसे कैच नहीं करता है. हम लोग इतनी मेमोरीज कैच करते हैं that we are trying to bring those memories together and then put our thoughts together and start counseling. So a counselor should be very, very clean, sparklingly clean. Anyone gives any information, processes, heals, and the patient goes and mirror again becomes clean. This is a beautiful statement given by me. That it should reflect, it shouldn't absorb. The day we start absorbing, then we become like a dirty sponge end of the day. A counselor will need another counselor. And this we like to hear from Dr. Veena and Dr. Amita and Dr. Poonam, that who presses their sponge, who takes out their negative energies or positive energies, whatever comes to their mind. A counselor should be having free-flowing thoughts, confidential thoughts, non-judgmental, and welcome any thoughts. We become close very quickly. We become close to any thoughts. That's not the way counselor should work. There is no judgment. It's only listening and hand-holding. That's all it requires. For me, counseling is like this lovely drink. Lovely drink. See, every ingredient had got a place in it. a grain of salt, a dash of lime, even a spill of this drink, like a virgin mojito or something, is giving you a flavor, a light sparkling through it. This is what a counselor does. So what actually got me towards raising this group called CEP was I was very much amazed at why does my counselor, my psychologist, she was a psychologist, takes every patient by looking at her into her eyes and she starts drawing, make them draw some apples, some butterflies, some trees. I didn't know this till the time she told me to read about Herman. So they have some sort of paintings, drawings are there. Looking at them, they look at your interpretation. Is it a butterfly or is it an elephant? And then they tell what's in your mind. And it must be working. I think it's a part of the curriculum also for the psychologists. Again, so use the right tool, right person. So is the counselor is the only counselor? Do you need a degree to be a counselor? Do we need an individual to be coming to you and teaching you which screw to be tightened with which particular tool? But there I don't agree to it. Who can be counselor? A counselor may not be a woman or a man who can make other people lie down on a couch. I've taken counseling myself. In corporate, when I was heading one of the corporates, I had a personal counselor and life coach. And they were charging rupees around 70,000 per hour. That was a part of my job. I had to be counseled. And all corporates have such, they may even take 2 lakhs per hour. And just lie down and they talk to you. They give you some negative or positive reinforcements. And I firmly believe in the power of subconscious mind. A lovely book by Murphy, in case you've not read, must read that. This is what these people do. But I feel counselors who have got a degree with them, an outpatient department, when you look at somebody sitting at the billing department, somebody sitting at the counter, or executives at the counter, they can counsel. They can be very positive towards the patient and hold their hands. A nurse can be a very good counselor. You don't need a counselor to be there in a very serious atmosphere. I think every day we should be counseling. At the front office, a nurse talking to a patient, pharmacists, I think they are the most important counselors in IVF because they are giving all the drugs. Yes, they talk to the patients, communicate with them. They can do very good counseling. Liftman. In the army, when I was handling 400 patients, couples a day, the liftman was the biggest counselor. They could tell me this patient is going down. To get them back, talk to me. Parking lot people who do the parking of the cars, they can be the counselors. And they were my counselors when I was in the army. My favorite place of counseling was the cafeterias, where the people who serve food, where doctors go, patients go. They are the people, they come to know how patient temperament is, negative IR. They're very low. They are breaking down, they're crying. So people could be got back. So cafeterias, canteen, people who's waiters, they all can be our counselors. So counseling is a big team. It's not only about having a counselor who's qualified in a degree. Yes, they are the chief counselors, but I think everyone comes together. A liftman, a person at the parking, a nurse, front office, biller, pharmacist can all be counselors. I think so we should move away from technology is a very, very good thing to do. We normally give people a lot of sheets to fill, but I think human touch is a very important thing. Learn to touch people. When we see any patient, I tell everyone just touch her feet. When I see every patient, before ultrasound, I touch her feet. It's my drill, I touch her feet. I know that I'm done with this. I've taken all energies from her, given her my energies. So I think as I end, a true counselor can be anyone. Every patient needs, why patient? You and me also need Jadoo Ki Chappi. We're looking at somebody who can give it to us. The biggest counselor from my side is Lord Krishna. It is not what I am saying. He was the person who could counsel Arjuna to win a battle. So I think we have got lovely book called Bhagavad Gita. They can be the best book to learn counseling is Bhagavad Gita. What to do, what not to do. Action in action. Action in action. And inaction in action. This is what Bhagavad Gita teaches us. This is the main role of a counselor. Thank you so much, Vicky, for giving me this lovely opportunity. and I've taken precisely 30 minutes. I know I've taken some bit more time, but thank you so much for allowing me to be here today and talking to all lovely people here. Thank you. Dhanabad. Thank you. We can't hear you, Picky. You're muted. Picky, you're muted.
Sorry. So, thank you very much. It was really a wonderful, आप बिल्कुल दिल से बोले, and I think it was a wonderful, you gave a very, I think you could have been a counselor, and you are a counselor. You have all the good qualities that you showed for a counselor to be. So thank you very much, sir. And next I would invite Dr. Shweta Mittal. Dr. Shweta Mittal, you is the co-director and unit head Center of IVF at Gangaram Hospital. We all know that she's the Secretary General, but Dr. Shweta, I am really impressed with you. You are not only the most sought after clinician, but I would like to tell everyone that you are an excellent surgeon also, and your administrative skills are also great. And she's a lovely human being. So we would like to hear from you, Dr. Shweta.
Thanks, Dr. Picky. I think we have heard a very, very elaborate, overview from Dr. Pankaj about, it's a different aspect of counseling, what we have heard. I think the program which was made is to encompass what happens is, practically I'm speaking, when I'm sitting in the OPD, the moment patient takes more than 5 or 10 minutes of mine, and then I say that, okay, go to Dr. Veena, who is a dedicated counselor, and she's going to tell you what are the visits, the procedures, the complications, what are you expecting, the financial counseling. And so it just comes down to that we give that responsibility of convincing the patient to our counselor. So this is how important it is. And if my patient doesn't come back to start IVF, I know that the counseling has gone wrong. So I think very, very important aspect is to see what are your dropout rates, even after first failed IVF, even after second failed IVF. If your patient comes back to you, then that means your counseling has been honest, it has been scientific, it has been perfect, it has been evidence-based. So what is our aim by doing this counseling program is that we have made small modules. Dr. Picky has very comprehensively, along with Dr. Poonam ma'am, and I'm sure Dr. Geeta ma'am, different modules where we are bringing in different aspects. We will be having dialogue, conversation. We will be having case scenarios. At the end of 5 or 6 modules, what we wish to do is that if we can provide, these are recommendations. First of all, please understand they are not guidelines, so that we will be able to get a ready reckoner. And at the end of it, every center can keep this so that your counselor knows. And counselor cannot do counseling if they don't have medical knowledge. So it is very important, like in our center, Dr. Veena always attends all the lectures. So it is important that counselors also attend lectures which are pertinent to their counseling. For example, if she has to say that, the risk of severe ovarian hyperstimulation is 1%. Now, how did she come to this conclusion? What is severe ovarian hyperstimulation? So the counselor, if they are not aware, they will just speak like a puppet. We don't want that. We want them to be more knowledgeable and to do the right counseling. So Dr. Picky has made beautiful, modules, and I'm sure that at the end of 5 months, we will be able to take out a ready reckoner, which will be kept in all the centers so that the counselors can just do the tick mark that, yes, we have done this much of counseling, which was of most importance. So thank you, Dr. Picky. I'm handing over to you so that, you can carry forward with your program.
Shweta, thanks to both of you, Dr. Pankaj and you, for taking out time for our program. I know the EVM is going to be held very soon, so thank you very much.
Yes. So we finished before the EVM, right? Thank you.
Thank you. So I also want to introduce Dr. Geeta Khanna. Ma'am is our mentor for the CEP program, and she's also the vice president. Ma'am, your picture is so beautiful. I always say the beautiful lady is Dr. Geeta, and she is the vice president of Indian Fertility Society, UP chapter. And along with this, we have our second mentor. Ma'am, Dr. Poonam Nair is a clinical psychologist, a very accomplished person, and she's guiding us through this journey, which was very new to all the doctors. And she has roped in all the best counselors for us. So thank you, ma'am. And ma'am is also the convener of special interest group counseling psychological support. And we have my very dear friend, Dr. Leena Vadva. She's the professor and head at ESI Medical College, Alwar. She is now the treasurer of IFS, and she's the team leader of second team, and she will be taking over next. I would just take a minute to introduce Dr. Veena Acharya, who is doing a wonderful job. She's a counselor at Sir Gangaram Hospital, deals with all kinds of patients, and is the real counselor and has prepared a beautiful session for us. And also Dr. Amita Puri. She is a very, very academic person, a very sought after clinician. And she, as you can see, she has, her new book has just come in. So you will be getting to see her. A very small glance of all the team members. And finally, I hand over to Dr. Leena for carrying forward the program. She's the
Thank you, Dr. Picky.
team too.
Yeah, can I share my screen?
Please.
Yeah, thank you, Dr. Picky, for the kind introduction. And so we start with today's program. Okay, this, I want to open my PowerPoint. This I'll cancel. Okay. इसमें PowerPoint open क्यों नहीं हो रहा? Should I cancel and first open it on my?
I think Dr. Leena, first you open your desktop. Slideshow में मत करिएगा, and then you can see it on the screen and just click on it. That is what you need to do.
Okay, I'll just open it first.
Yeah.
I'll open the PPT first.
Now you slide screen share करिए. नीचे जो वो चलता है ना share screen.
Okay, I've opened the PPT. Now I will.
उसको नीचे down नीचे कर दीजिए. Minimize it and open. ये जो है ना नीचे आ रहा है green color का share.
हाँ, share screen कर दिया.
Yeah.
Okay, share किया है. So, is it visible now?
We can't see your screen, Dr. Leena. Atul, please help Dr. Leena.
Leena ma'am, have you opened your PPT?
Loading.
Yeah.
तो जाएगा.
Yeah, we can see now.
Great.
Is it visible now?
Yes. Visible.
Yeah, thank you, Dr. Picky. So quickly now our team of Dr. Veena Acharya, Dr. Amita Puri and myself will introducing today's session. And in this session, we'll start about when initially you have an infertile couple visiting to you. How do you go about it? And when you start with the initial consultation, you try to establish a rapport and ensure privacy, and you want to collect the basic demographic information. In fact, we'll be showing you a dialogue between the two counselors, how the things what I'm mentioning, practically you will be able to see it also. So apart from that, you also inquire about the lifestyle factors regarding smoking, alcohol, and any other drug usage, and about the exercise, their stress and mental health. So these things are also very important when we are talking to patients, taking them into confidence. And apart from that, we also need to know about their occupation and their environmental exposures, their work-related stress. Apart from that, the other issues which needs to be addressed, very important, is partner dynamics. So after the fertility issue has been diagnosed, how is their relationship going? Is there any significant change in the relationship? How is their communication between the couple? And when the counselor is talking, even by the verbal cues, they are able to address this issue. So apart from that, the detailed history taking, information gathering from the couple, from the female, regarding her menstrual history, medical history, sexual history. This is very important, whether cycles are regular or they are painful. What about the previous pregnancies, if she had conceived, any treatment she has taken, any specific problem she is suffering from, like PCOS, etc. Or the details of her infertility journey, which she has gone through her experiences in the previous clinic. So all this is very important in history taking. And from the male partner also, we should inquire about the medical and surgical history, the sexual history, lifestyle, and occupation. So this is all very important. Apart from that, the family history, if there's any genetic problem or any fertility issue in relatives, that also should be inquired. So not only the obstetric, gynecological, medical history, the assessment of the emotional status of the couple is very important. And regarding her social support with partner, family, or maybe it may be outside family. So you need to provide support and counseling options, and financial counseling also, sir has already mentioned. So the objective is to identify the potential cause of infertility, and this is to guide the diagnostic and therapeutic decisions and to provide empathetic support to the couple. So you need to summarize, you need to outline what are the diagnostic tests, and you need to discuss the treatment options. So let us see how our two counselors, the duo, they interact and tell you how to take a detailed history when an infertile couple comes. So Shimu, can we have the video on of the duo?
Sure, ma'am.
Yeah, please. We have Dr. Amita and Dr. Veena with us. They are the duo who will be showing you how to gather the information when an infertile couple comes.
Evening. I'm very well, ma'am. How are you?
Great. Yeah. So regarding this Counselor Empowerment Program, so we are meeting so many counselors these days and talking about what they are doing in their own sphere. Everyone is trying to do many innovative things. So Dr. Veena, I would like to know what you are doing in your space and what innovative things you are doing out there.
So innovative. I think we are trying to understand first what the patient really requires, what kind of treatment patient really requires, and for that we go at length into the history, the information that we derive from the patient regarding her age, her marital life, her past treatment history, any conceptions, natural conceptions, or any assisted conceptions, and about their coital frequency, even the background, if they have enough personal space, how is their bonding, and any treatment history, any medical history or surgical history. So basically, you are trying to get at the root of what could be underlying the infertility. And after that, we have a variety of treatments to offer to them. So according to the need of the couple, we suggest treatments.
Yeah. So it's basically initially trying to understand and gather information from various aspects so that we understand the root cause of the problem from various dimensions. And also we include psychosocial aspects, the psychological aspects, the emotional support and care they have, or about their family members and the relationship dynamics. And even when they are talking to each other, the way they are looking at each other, the way they are talking about each other, and talking about the history only, even if when they are talking about the medical history, the verbal and non-verbal cues also, we as clinicians, as counselors, we are on the lookout for those. And after taking the history and all the details, then there are psychosocial screening tests which we use. And those questions are very simply framed, but they are very effective in actually telling us, identify various aspects of the person's psychosocial status in terms of relationship dynamics, which is very important. His own personality patterns also emerge from those screening tests. while we are talking. And the best part of these tests are that when we are talking to them in a conversation manner only, many things come out. Now, this is also something which happens during the first two sessions, wherein we try to approach the issues from various psychological angles in helping them, because the more they are comfortable with each other, the medical compliance will also be better, and the healings and other treatments they'll also be more comfortable with. So it's a
You have a set of questionnaire that you offer to the couples to detect their compatibility.
Yes, there are. The screening tests are there, and once we know that there is we identify some problem areas or maybe questionable, areas, then we have certain other personal relationship dynamics and his personality profiling. So these things are very important, and they help us actually help the patient better. And that's the whole purpose
And
of this
also,
consulting.
I think information about their, past test, the medical screenings, and if any treatments in the past, that can also help us arrive at a conclusion. Their tests are very, very vital in deciding where lies the problem.
Exactly. Tests along with the clinical judgment, because we are looking at
Yeah.
them, we are nudging at each other, the way they are looking at each other, the way they are scowling at each other, the way they are talking about the past history. So verbal and more importantly, non-verbal cues, the counselors, they need to be more alert about. And that is what this training is also about, to heighten this third eye. So they can sense the things, they can catch those vibes in a scientific manner.
Definitely. So perhaps you can share some set of questionnaire screening tests that you have later with us,
Yeah.
so, which we can also, look at in our counseling sessions.
Yes, during the training.
Maybe we can offer to our patients and, maybe get more information about their interpersonal relations.
Yes, and our book on counseling in art, which came out in the conference last year, in IFS conference, the counseling in art. So that book also contains those tests and how to score, how to administer, how to interpret. And of course, we'll be training the counselors also on the nuances of these testings and how to use your clinical judgment. And then once we have identified them, then how to go about in the therapeutic intervention. There are various kinds of therapeutic interventions, and this is also is going to be part of training for them, so that they can help the individuals who require this help better.
Yeah. And Dr. Amita, why do you think can counseling help a couple conceive? What percentage of couples could conceive just by counseling without any medical intervention?
It has to be a professional handshake between the clinician, the medical personnel, as well as the counselor. So it's a professional handshake, and when we work together as a team, then and we put the couples also on our team, that let them feel that they are part of our team or we are for them. Then yes, certainly, because emotionally they get connected, psychologically they get connected, socially also they feel that kind of emotional support from the team. So when we meet them, it's like extended family. That kind of support once they have, then certainly percentages are bound to improve. And that is once again this empowerment training program is, yeah.
Absolutely, yes.
And many people are doing wonderful things at their places, and this is the time to connect with everyone and letting us know about what they are doing or sharing of information. KT, knowledge transfer, knowledge sharing is going to be really wonderful. I'm looking forward for this program to expand.
Yeah,
And
definitely. I'm looking forward to also learning lots of tips from our ongoing sessions.
okay, thank you so much. It's been nice.
Okay, thank you so much. Thank you.
Okay, Jay. Yeah.
Yeah, thank you, Dr. Amita, Dr. Veena. It was a wonderful connect with the couple, how to gather the information in detail. So after that, let's imagine a couple who is coming to us. She's a young patient, but who has been told that her reserves are on the lower side, and she's very upset about it. And she comes to you, that doctor, or she comes to the counselor and tells that I've been advised the need for egg donor. She needs emotional support, and simultaneously she has many her apprehensions regarding the oocyte donor. So let's watch another video compiled by Dr. Veena Acharya from Gangaram, how to deal with such a situation when a couple comes with the need for oocyte donor. Shivam, you can please switch on the video.
Good evening, everybody. I'm Dr. Veena Acharya. I'm working as medical officer at Sir Gangaram Hospital. Today I have a patient for counseling for donor egg IVF. She has agreed to be on the call, but for privacy reasons she does not want to be seen in the video. She does not mind being heard. So, hi Vishakha. Yeah. So, she is a 36-year-old girl with irregular menses for last 2 years, trying to conceive for last 5 years, and her AMH is very low, 0.08 nanogram, and her hormones FSH, LH are high, and therefore for better results she has been advised donor egg IVF. So hi Vishakha once again. So बताओ तुम्हारी क्या कंसर्न्स हैं?
मैम, मुझे डोनर एग के साथ आईवीएफ के लिए बताया है मैडम ने। तो मैम, मुझे एक तो प्रोसेस समझना है कि क्या कैसे होता है, कैसे डोनर हम क्या चूज कर सकते हैं, क्या कर सकते हैं, कैसे।
तो डोनर जो है वो आपको एजेंसी से लेना होता है, ART बैंक या डोनर बैंक होता है। ये बेसिकली एक एजेंसी होती है जिनके पास विलिंग गर्ल्स हो। वो आपको जो डोनर है वो 23 साल से ज़्यादा और 23 से ज़्यादा की और 35 से कम उम्र की होनी चाहिए। ज़्यादातर एजेंसी जो है वो 30 ईयर्स से कम की डोनर प्रोवाइड करती है। और ये डोनर जो होती है मैरिड वुमेन होती हैं जिनका 1 या 2 बच्चा होता है, तो हमें इनडायरेक्टली उनका फर्टिलिटी का थोड़ा आइडिया लग जाता है उससे। और फिर उनका पूरा मेडिकल टेस्टिंग होता है और उनका एग रिजर्व भी टेस्ट होता है, AMH वगैरह, एंड इफ ऑल इज इन प्लेस तो वो प्रोफाइल वो लोग सेव करके रखते हैं और वो प्रोस्पेक्टिव रेसिपिएंट कपल के साथ शेयर करते हैं। तो थोड़ा सा शेयर करेंगे। आपको अपना कुछ डिटेल उनको देना होगा, अपने अपीयरेंस के बारे में, हाइट, वेट, अपना कॉम्प्लेक्शन, जो आप जिस उसको बिलोंग करते हो एरिया को, ताकि वो आपसे थोड़ा बहुत मिलता जुलता सा डोनर आपको सेलेक्ट करके दे पाए।
मैम, मतलब क्या प्रोसेस होता है प्रेग्नेंट होने का, कैसे?
हाँ, मैं बताती हूँ। तो एक बार जैसे आप डोनर सेलेक्ट कर लेते हैं तो पीरियड के दूसरे दिन से डोनर हमारे पास आती है और उनके ब्लड टेस्ट, अल्ट्रासाउंड होते हैं, और इफ ऑल इज गुड वी स्टार्ट विद इंजेक्शन। दीज इंजेक्शंस आर टू stimulate her ovaries to make more number of eggs, and intermittently हम उनको मॉनिटर करते हैं बीच बीच में। और जब उनका फॉलिकल्स मतलब जो एग्स हैं वो पूरे रेडी हो जाते हैं तो वो अंडर एनेस्थीसिया उनकी बॉडी से हम रिट्रीव करते हैं जनरल एनेस्थीसिया में। उस दिन आपको आना अपने हस्बैंड के साथ। आपके हस्बैंड को एक फ्रेश सीमन सैंपल देना होगा। एग और स्पर्म को हम बाहर फर्टिलाइज करेंगे लैब में, और फिर उस एम्ब्रियो को हम कल्चर करेंगे, ग्रो करेंगे, और जब वो ब्लास्टोसिस्ट अच्छे बन जाते हैं डे 5 डे 6 तक, उनको हम फ्रीज करते हैं। फिर उसके बाद ये एम्ब्रियोज आपके अंदर ट्रांसफर होंगे आपके मेंस्ट्रुअल साइकिल के हिसाब से। लेकिन इससे पहले जब आप एजेंसी से मिल लेते हैं, सो देयर विल बी अ लॉट ऑफ पेपर वर्क टू बी डन। तो आपका आपका खुद का नोटराइज डॉक्यूमेंटेशन होना चाहिए कि आप अपनी मर्जी से ये डोनर एग कर रहे हैं और इससे जो बच्चा रिजल्ट होगा उसको आप एक्सेप्ट करेंगे। और इसी तरह से डोनर को भी एक एफिडेविट देना होता है कि वो अपनी मर्जी से डोनेट कर रही है और उसका होने वाले बच्चे पे कोई हक नहीं होगा। और डोनर का एक इंश्योरेंस भी होता है कि इन केस प्रोसीजर के दौरान, ट्रीटमेंट के दौरान कुछ कॉम्प्लिकेशन हो और डोनर को एडमिट होना पड़े तो वो इंश्योरेंस उसको कवर करता है। ठीक है। और जो तुम्हारा एम्ब्रियो ट्रांसफर है वो होश में होगा, वो तुम्हारे मेंस्ट्रुअल साइकिल के हिसाब से जो करेक्ट टाइम ऑफ एम्ब्रियो इम्प्लांटेशन होता है उसी टाइम पे हम लोग जज करेंगे कि कब आपको वो टाइम हम देंगे और फिर इस एम्ब्रियो को नॉर्मल पैसेज से जाते हुए आपकी यूट्रस की कैविटी में हम प्लेस करते हैं। एक अल्ट्रासाउंड गाइडेड प्रोसीजर है और इसके बाद फिर आपको सेम डे हम डिस्चार्ज कर देते हैं।
मैम कितनी गारंटी होती है प्रेगनेंसी की?
देखो, गारंटी, प्रेगनेंसी की गारंटी तो नहीं है इसमें, बट मैं यही एश्योर कर सकती हूँ कि इसमें बहुत हाई चांसेस होते हैं क्योंकि इसमें कोई यंग फर्टाइल गर्ल है तो उसके कारण देयर इज अ वेरी हाई चांस दैट यू विल गेट प्रेग्नेंट।
मैम बच्चा तो हमारे जैसा लगेगा, कैसा लगेगा?
बच्चा देखो ऐसा है कि इम्प्लांट तुम्हारे अंदर होगा, बच्चा ग्रो तुम्हारे अंदर होगा, ब्लड तुमसे मिलेगा, न्यूट्रिशन तुमसे मिलेगी, इमोशनल बॉन्डिंग तुमसे होगी और वो बच्चा ग्रो तुम्हारे घर में होगा। तो so you know the mannerisms of course will be the environment, the mannerisms, the choices, lifestyle, food choices, everything that is from your house. So there is a high chance. I have so many couples. मेरे पास अभी लास्ट वीक ही एक मदर आई थी अपनी डॉटर के साथ, शी इज कम फॉर अ सेकेंड बेबी और वो इतनी प्राइड से मुझे बता रही थी कि ये सब इसको मेरी बेटी कहते हैं और मेरे से शक्ल मिलती है। सो शी वाज सो देयर इज अ हाई चांस, बट यस फीचर्स तो आपसे मैच नहीं करेंगे, बट आपके हस्बैंड के तो जीन्स पास ऑन होंगे। सो आई थिंक इतना कुछ बहुत आपको इस बारे में एंशियस नहीं होना चाहिए।
मैम बच्चे को पता चलेगा या कैसे उसको बताना है?
देखो, बच्चे को अपने आप तो नहीं पता चल सकता, तो ये डिसीजन तो आपका और आपके हस्बैंड का रहेगा कि आप अपने बच्चे को वॉलंटरीली बताना चाहते हैं कि नहीं बताना चाहते। दैट्स अ चॉइस दैट यू हैव टू मेक। और अगर आप लोग बताने का भी सोचें तो ओनली आफ्टर दैट he or she is a little mature to be able to handle this information. And then you can take help of a psychologist that time कि हम कैसे इसको बेस्ट ब्रेक कर सकते हैं इस न्यूज़ को।
और मैम मेरा ऑफिस रहता है, 9 to 5 की जॉब है, सिटिंग जॉब है, तो मेरे को कितना रेस्ट ब्रेक लेनी पड़ेगी, कितना रेस्ट, कितनी विजिट्स?
आपको बहुत विजिट्स नहीं होंगी, आपकी 2-3 विजिट्स होंगी यहाँ पे मॉनिटरिंग के लिए। हमें करेक्ट टाइम देखना होता है एम्ब्रियो ट्रांसफर कब करना है, जब यूट्रस रिसेप्टिव है इस एम्ब्रियो को एक्सेप्ट करने के लिए। और वो प्रोसीजर विदाउट एनेस्थीसिया तो आप सुबह आओगे, डे केयर है और शाम तक आप डिस्चार्ज हो जाते हो। और उसके बाद मतलब द डे ऑफ ट्रांसफर एंड द फॉलोइंग डे फिजिकल एक्सर्शन नहीं करना है आपको, बट आप अपनी नॉर्मल एक्टिविटीज कर सकते हैं। मूवमेंट का कोई रिस्ट्रिक्शन नहीं है, बेड रेस्ट एक भी दिन का नहीं है और खाने पीने का कोई परहेज नहीं है, वर्क कर सकते हो। और बाकी मतलब यू कैन बी इंटीमेट विथ योर हस्बैंड और कोई ऐसे बहुत कुछ ऐसे प्रिकॉशंस नहीं है जो अलग होंगे। मॉनिटरिंग प्रेगनेंसी की सेम होगी जो नॉर्मल प्रेगनेंसी में होती है, सेम होगी। और आई थिंक यू शुड डिस्कस इट नाउ विथ योर हस्बैंड एंड डिस्कस इट विथ योर फैमिली इफ यू वांट टू मेक अप योर माइंड, टॉक टू द एजेंसी and if you decide to go ahead you have to come back to us and we'll have the paperwork and consenting and we'll get you started.
Thank you.
Thank you. Thank you.
Yeah, thank you, Dr. Veena Acharya. That was very nice live interactive discussion which you have shown us and how to resolve the queries, what the so many things the couple, the patient is having in her mind, and you have given nicely counseled her. So, any inputs from your side? Anything you would like to add on, Dr. Veena?
Thank you, ma'am, for your kind words. So, so I understand, the patient do come with anxiety, but mostly what I feel is that the couple is relieved. Mostly these couples have undergone multiple their own cycles, or because of POI or any such thing that they cannot get their own gamete baby. So they are just happy that there is a way that the woman can get pregnant. They are, of course, they want to understand how it is going to work, how a different woman's egg can make her pregnant. But beyond that, I think mostly women are, very happy and relieved that at least this will offer them a good chance of getting pregnant. And
Yeah,
also, one very
Dr.
strange
Veena
thing
and Dr. Amita, I would like to take this opportunity to congratulate both of you. I think you've covered most of the important points, the anxieties, the challenges, what the couples are facing, and you have really addressed them very well. So, Dr. Geeta is also there with us, and I would request Dr. Geeta, our mentor, to give her remarks or her thoughts regarding this.
Yeah, I must congratulate at the very beginning, such a nice proceeding. Actually, it is all required, and we really welcome Dr. Pankaj Talwar, and he spoke so beautifully, and Dr. Shweta Mittal. That was really, and today having them in our meeting was real boon. And then it was very good by all the three people who were talking. It was a interactive session was especially very important, and I think the role play will come later on. That is another important thing that we can have. And can we have that role play from different clinics? You can just give us the topic. So some clinics, they have lot of I mean juniors, they can be taught, like, and they will love to, they'll have fun in doing all this work. So the seniors will be guiding them, and actually something like natak. So it will be so good.
Good idea, ma'am.
Right? So
Yeah.
जैसे nukkad natak we were doing for delivery cases, PPH and APH and preeclampsia and all. The same way we can do for this also, and they can talk about the apprehensions, their apprehensions, especially the social apprehensions they have from their in-laws, from husband, or the fears they have, the baby will not match us. And nowadays we see a lot of couples, they are opting for oocyte donation, and we are seeing a lot of patients having very low AMH at very early age. So counseling does give them a lot of support, and we can see the nice, beautiful result of your nicely counseled patient. You can get an oocyte donation IVF very nicely. Thank you, and
Thank
I
you.
congratulate you again.
Wonderful,
And
ma'am. Thank you. Such a good overview, new idea. Thank you very much. And actually, Astha, our AI expert, she's traveling and she's not able to connect. She has sent a video, but that's not working. So at the end, we would request Dr. Poonam, ma'am, our second mentor, to give her concluding remarks. And then we can have that small session of Dr. Amita Puri. Thank you so much, Dr. Geeta.
okay.
Yeah, thank you. It was a very interesting, and it's always a learning experience to hear from so many different perspectives, the viewpoints of others. Now, basically, we are talking about giving them the information and the steps in foresight in this donation process. And that is a very important part of the entire counseling paradigm, that when they have the correct information, the anxiety itself reduces just from that. So that is really important. The other point is that the emotional impact of having a donor, a baby from a donor, when the couple get married, they have the dream of our child. So they are actually looking. That is why they come for IVF. Otherwise, they could go for adoption, or so many other options are there. But when they first hear the news that they cannot have, you see, in one sentence, when the clinician says, okay, आपका ये नहीं है, gamete नहीं है, आपको donor चाहिए. So that is a one sentence interaction. And there is no room for them to explore their feelings and to express their views. The emotional impact flashes on their faces. So it's not really opened out in the clinic setting with the clinicians. So like Dr. Veena said, confidentiality, taking them aside. And if you have to go by the steps, maybe the first step is grief, that I cannot have my own child. It's going to be somebody else's child. And there is a whole process of reorienting and transitioning. You have to let go of the traditional concept of parenthood, and you have to reorient to something which is completely new, that is a non-biological child. So a social parenthood. And this requires addressing many issues regarding will the child look like me, like Dr. Veena said, or that feeling that is this really my baby? Is it your baby or our baby together? Is the husband also going to accept in the same manner? We've had cases where the donor sperm was used, and at the end of it, the man said, I cannot relate with the child. This child feels like an alien. Now, these are the things that have to be averted, because we are looking at the future of a child also. It's not just giving a pregnancy and that's the end of the story. It's the whole life of the child involved. So it is important that they should get reoriented properly. They should be able to renegotiate this transition and then fully accept it, not just theek hai ho jayega. So this is a 4-step process, and I think like the counselor has to be able to go through each step in a systematic manner and cover the areas like who's going to know how much. There has to be a consensus between the husband and the wife that who all are they going to tell about it, if at all anyone. That at times you get couples where the wife says, even don't tell my husband. Well, of course, we don't do that. We are not allowed legally, but they want to keep it that secret. So these things have to be addressed and taken up so that it becomes their child and not her child or his child, and they are able to, there has to be an openness about whatever concerns they have, the wife, and how long the confidentiality should be maintained, if at all, when the disclosure should be there, because we have cases also of donor children who find out at the age of 20 that this is not my father. And after that, they are obsessed for 3-4 years. I want to see who is my biological father. I want to meet him. And they go all over the globe on the net searching, and they end up finding 20 siblings, and they make a WhatsApp group. And so, all these are there are more questions than answers, I suppose, but these are the things which need to be looked at in a specialized counseling. And where I think Dr. Amita's session is very helpful, because we are going outside the academic information realm, the objective realm, into the subjectivity of the human being who's experiencing. And that is a lot of emotion, more emotion that has to be handled rather than just data about what is happening. So I think we are fortunate to have her. She's expert in this kind of emotional healing and emotional connection. And I think I would love to hear what she has to say now.
Yeah,
Thank you, Dr. Poonam. So I'm just going to do this a small demo, 2-3 minutes demo of maternal bonding visualization therapy. So you have said very aptly that we are dealing with human emotions, we are dealing with human beings, and we are dealing with grief. And when the baby baby which is conceived through donor egg, it's very difficult for a mother to go through all those gamut of emotions. And hence, we are doing this maternal bonding visualization therapy. So I'll suggest each one of you please close your eyes and listen in to this relaxation, trance and bonding visualization therapy which we do with the mothers.
Yeah, Shibam, you can
So
play
please
the
close your eyes.
you can play the video.
So please close your eyes. Please close your eyes and focus only on your own breathing. Loosen up your body limbs from head to toe. Focus only on your own breathing. You're breathing in and breathing out. You're breathing in and breathing out. With the belief that every breath which is going in your body, making you more comfortable, more and more relaxed, more and more in control of your own life in this very moment. This is a moment to pause and ponder, to reflect upon this wonderful gift of prana shakti, pranayam, which God has bestowed on all of us. We are because we breathe because we are. So we breathe in the power, we breathe out the pain. Visualize that from each and every cell of yours, from head to toe, each and every cell, the toxins are going out, the anxiety is going out, the stress is going out, the grief is going out as we breathe out. We breathe in the power, we breathe out the pain. And visualize now a beam of white light from the skies is coming towards you. Beam of white light from the skies is coming towards you, and riding on that beam of white light is a very, 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 very tiny infant, tiny child, a baby, and is coming towards you, this beam of white light. And as it's coming towards you, this small baby is looking at you with smile in its eyes, is looking at you with love, lots of love. And you're also looking at this baby with lots of love, and baby has hugged you. It's coming onto your stomach, and you can feel the baby's head on your stomach, on your body. You can feel the baby's limbs on your body, on your abdomen area. And your heart and your mind is full of love, filled with love. Each and every cell of ours. Our body is made of trillions of cells, and that is who we are. And each one of those trillions of cells are oozing out love for the child in this very moment. So lots of energies emitting from the child, lots of energies emitting from you towards the child. You can actually visualize those energies, energy cords from the child's body and from your body intertwining. Feel the warmth. Feel the love. And as you're feeling this love, you're filled with love. You're filled with a sense of belongingness with this baby. Pink, baby pink white light, golden showers are showering over you from the skies, the blessings from the skies. in the form of those golden petals which are showering over you and the baby. And you're just sitting there in wonder. Own this moment. This is your moment. And slowly, slowly, please put your hands together in Pranam Mudra. Rub your hands together. Put them over your face. Gratitude, gratitude, gratitude for this wonderful special moment which God has bestowed on us today. And with a beautiful bright smile, you can open your eyes and come to the present. Yes. Thank you for this small, just a glimpse of what we do in maternal bonding visualization therapy.
Yeah, thank you. Thank you, Dr. Amrita. It was wonderful experience, enlightening. So,
May I add one sentence? Just it just struck me while she was doing this that we have a very elaborate process, traditional process of Garb Sanskar, which takes the woman through bonding with the child over the entire 9 months, and I'm sure that can be very powerful in giving a proper connection between the mother and the child and the father also. It's there are people who are doing it, Dr. Shubhanil, and they integrate Raj Yoga meditation into the whole process. So I think that
thank you, madam, for the information. And we had a very nice, wonderful session. And now I would like to close this program. And I would like to thank our mentors, Dr. Geeta and Dr. Poonam Nair, for their contribution.
Thanks.
And we'll close the session now. Thank you. Thank you very much. Thank you, Dr. Veena, Dr. Amrita. Thank you.
Thank you.
It was
Thank
nice
you, ma'am.
to meet you.
Bye.
Thanks,
Everyone.
everybody.
Bye, Dr. Veena.
Thank you. Thank you. Yeah.
Thanks. Thank you.